Hi, I'm Piper, certified baby-wearing educator and owner of Baby-Wearing Doula and the Worn Baby. Let's talk about ring slings. A ring sling is a great carrier because you can get baby in and out very, very quickly. It is a one-shouldered carrier, meaning it uses just one of your shoulders for the weight. If you have neck or back issues, please look at the option of a two-shouldered carrier, like a Metai or a wrap. And because this does use one shoulder, while it can be used from newborn through toddlerhood, once your baby gets heavier and their weight goes up, the time span that you can use this actually goes down. The rings are what make it a ring sling. This is important because it allows for adjustability. So, should you have just one carrier for multiple wearers, this would be a very great option. The shoulder of the carrier, this one is gathered. Many are pleated, or some are called a hot dog style. There are many different options for a shoulder. I prefer, if you have never used a ring sling before, to use a pleated or a gathered shoulder, simply because it basically lands where it needs to with very little effort from you. Then you have the body of the sling. This is the fabric that goes around you and your baby. The fabric is threaded through these rings and comes out, and this is what we refer to as the tail. Now, where you put your rings is important. I tell most people use your dominant side. Rings will go dominant side. Another way to look at it is if you were to carry a baby on your side or your hip, you want the rings opposite of that side. I carry on my left, so again the rings are going to go on my right. To put this on, your left arm goes through so that the rings sit on the right side. If you're going to put the rings on the left side, your right arm will go through. Now, when you have this on, you want to start the rings up high. Many instructions tell you to put the rings at corsage height. Personally, I've worn a corsage, never. So I tell moms, you want the rings to encircle the clip on a nursing bra. If you are not a nursing mom, or perhaps a man, you're going to want them to hit right about the collarbone. Right underneath there's a hollow portion. Then you have the shoulder. Like I mentioned before, this one's gathered. You want it to cup the ball of your shoulder. This is going to help with the weight distribution. If it's all up here at your neck, it's not going to be comfortable. It's going to cause strain. If it's all down here past your shoulder, you lose the use of your arm, defeats the purpose of what we're doing. So, rings up high, shoulder spread. Then another important point is the fabric on the back. You want it to be spread out nice and wide. This will help distribute the weight of your baby. It also feels better and it looks better too, a little smoother. Then you're going to have all the rest of your fabric is going to come up front. This is where your baby is going to go. So let me grab my demo doll. Here I have my newborn demo doll, and we're going to show you the tummy to tummy hold in the ring sling. This is great for newborns because, as you can see, this is how we tend to hold them, especially when they're sleeping on our chest. It can also be used for older babies, especially if you have one that wants to snuggle and cuddle with you. As you can see, when you hold your newborn here on your chest, you're supporting their weight with one hand and their neck and head with the other. This is where your sling is going to go. To get baby inside the sling, you're going to lift baby up just a little bit. You're going to put one hand inside the fabric so that you can guide baby down onto your chest exactly where you would want them. Here, in this position, they can smell your scent, they can hear your heartbeat, and they can hear your voice, and they love that. This is the top rail, and the top rail is going to go about mid-ear level. This is where your hand naturally would lie, and it supports their head and their neck. All the rest of the fabric is going to be gathered underneath your baby. It's going to be under their bottom to their knees to keep them in that spread, squat, or M positioning. Once you have baby and fabric where you'd like it, you're going to tighten with the tail. The top rail corresponds to the inside of the tail. The bottom rail corresponds to the outside of the tail. This is what you'll use to tighten up. So we'll start with the bottom. I'm going to pull down and out a little bit to tighten up this bottom rail to support baby's weight. Then I'm going to pull the inside of the tail, and this tightens up our top rail. If you go up and out across baby, this will keep it from getting tangled in the rings. Then you can pull any extra that you need to help support baby in the middle. Once you have baby where you want them, make sure the spine is rounded. Very important for proper spinal development. You can also check fabric under their bottom and to their knees. This will help ensure that they're in the proper positioning for their hips. And you can actually kind of push up on baby's legs and maybe even out a little bit towards their bottom. So that will push their bottom more into the fabric and into what we call the seat of the sling. So you have your baby nice and tight and high and secure on you, and you can have your hands free to do what it is you want to do. To get baby out of the sling, you're going to use this ring that you can see. You're going to lift up, support baby's weight with the other hand, and then you can take baby out and do what you need to with your baby. Now, how about a hip carry? Now I have my larger demo doll, and we're going to show you how to do a hip carry. This carry tends to come naturally about the time baby starts to sit unassisted. So you'll put baby up higher on your shoulder because they are larger and longer. You're going to put your hand in again to guide them down. And this time they're going to be on your hip. Bring them down to hip level. The top rail is going to go up. You can start at about shoulder level, but listen to the cues of your baby. They will let you know if they'd rather have their arms out. Don't force them to do one or the other. The rest of the fabric will be tucked underneath their bottom to their knees, where your elbow would naturally cup their bottom. Keep them in that spread squat in position. And then we're going to tighten the sling around baby. Outside for the bottom rail. Inside, up and across for the top rail. And then the middle as needed for support for our baby. Again, check positioning for the spread squat position, pushing baby's feet up and knees out towards their bottom to keep them in their seat. And then they can again have their hands in or out. Get your hands out. And you've got a great hip carry that is hands free. Now, you've seen both the demo dolls for the tummy to tummy and the hip. How about I show you with a real baby so you can see how quickly you can use a ring sling. Okay, here's my live baby. This is Callaway. He's 15 months old. First, we will show you how to do tummy to tummy.
That.
Use that. All done. All done. Now we're going to show you how to do a hip carry. Yes.
Okay.
Right. Bring your arms in. Okay. Here it goes. All done. And that's how we do it. Should you have any other questions, please don't hesitate to email me at contact@wornbaby.com, or you can find me on Facebook also under Babywearing Doula and Worn Baby. Thank you, and happy baby wearing.